Hello and welcome to my community health presentation. My name is Lindsay. I will be presenting for community health nursing, and today we will be discussing prostate cancer. If you would please take a moment to stop and complete the presentation pretest attached in the description to see your knowledge prior to the presentation, that would be appreciated. Thank you. So what is the prostate? The prostate is a collection of glands that are covered in a capsule. Now the prostate gland lies just below the bladder and encircles the urethra. So if you could picture a donut, the urethra runs through the middle of the prostate. Women do not have prostate glands, so the population at risk here is going to be men. Specifically, this is going to be men between the ages of 40 to 80 years old. And prostate cancer is the malignancy within the prostate gland. So to start out here, prostate cancer is the second leading type of cancer in men, and men have a 50% chance of developing prostate cancer at some point in their life. Now, with every 10 years after the age of 40, the incidence of prostate cancer nearly doubles. And then, so that is related to age. Smoking, of course, increases the risk of any sort of cancer, prostate cancer included. Ethnicity. Prostate cancer is 66% more common in African Americans, and with that prostate cancer in African Americans, it is twice as likely to be fatal to them versus Caucasians. Agent Orange. Some research has been done that appears to show an increased risk of prostate cancer in veterans that were exposed to Agent Orange, but this also includes individuals exposed to ionizing radiation and ultraviolet radiation that comes from the sun. Family history. So family history, if you have a family member, obviously a male family member, that has been diagnosed with prostate cancer in your family, you are at an increased risk. If you are a male that has prostate cancer, other male relatives in your family, including brothers, sons, cousins, and nephews, are at risk. If you have a son, your son's risk varies based on your age at detection. So the younger you are at time of diagnosis, the higher the risk for your son or sons to develop prostate cancer. Now, signs and symptoms get a little tricky because there is another condition called BPH, or benign prostatic hyperplasia, that has the exact same signs and symptoms as prostate cancer. So when you are being ruled out for prostate cancer, you will be checked for BPH, or vice versa. If you are being treated for BPH, you will be ruled out for prostate cancer. Now, some of those signs and symptoms include an elevated PSA, which is a prostate-specific antigen. It's a blood test. Urgency and frequency of urination. Nocturia, which is the need to urinate frequently at night. The start and stop of urination. Pretty self-explanatory, but your urine stream is not consistent. It starts and stops. Feeling of not emptying the bladder. So you are urinating, but afterwards you feel like you have not emptied all the way or that you need to go again. Later stages can include blood in the urine or the semen, difficulty getting or keeping an erection, as well as back or pelvic pain. Now there's a few options as far as diagnostic testing. There are two tests that are done yearly starting at the age of 55. That's going to be the PSA, or the prostate specific antigen blood test, and then the digital rectal exam, which is the feeling of the prostate to check for any sort of nodules or hard spots, as it is usually a spongy rubber-like texture. If either of these tests come back abnormal, you will likely be referred to a urologist who typically manages prostate cancer and BPH. And if they feel that the need to investigate further is there, then the next step is a prostate biopsy. This is usually done in the clinic. You are awake. It is done via local anesthesia, so your prostate is numbed with lidocaine. It's about a 10-minute process where they go in and, depending on the provider, take anywhere from 12 to 16 samples of the prostate that get sent off to pathology to check for malignant cells. The alternative to that is a prostate MRI for those who want to forego the biopsy. This is done less often as the prostate biopsy is preferred. There is the option of having a fusion prostate biopsy, which is the MRI and the biopsy together. An MRI is done to detect lesions, and then the prostate, which is done via, the prostate biopsy, which is done via ultrasound, is matched, or the MRI prostate is overlaid the ultrasound machine and used to guide where to retrieve the samples from the lesions on the MRI. So there are different options for treatment. Given that there are 100+ types of prostate cancer, and they all have different levels of aggressiveness from low aggressive to highly aggressive, active surveillance is an option in which you do nothing and you monitor your PSA levels periodically based on your provider's preference to see how fast and how extreme your PSA is elevating. Hormone therapy such as Lupron, which basically blocks your testosterone. Testosterone essentially is food for prostate cancer, so if the testosterone is blocked, then the cancer has nothing to feed on. As with any other form of cancer, the option of radiation and chemotherapy are also there, and this is usually done with radiation oncology. And then there is the surgical option, such as prostatectomy, which would be done again with the urologist, and that is where your prostate is completely removed. Okay, prevention. As we know, there is no prevention to cancer. This is any form of cancer, so prostate cancer is no different. There are modifiable risk factors that I've included here. One of those is body weight. Obviously, overweight, obesity affects the body in negative ways, so maintaining an ideal body weight decreases your risk. Diet. There is some evidence that men who eat a lot of red meat or high-fat dairy products have a slightly higher risk of prostate cancer, as well as men who have a high calcium intake. So trying to have a better diet, eating more fruits and vegetables, less red meat, and low-fat diet could help you in that area. Physical activity is good for all bodies to combat multiple ailments, so prostate cancer is no different. And then there is minimal research, but there is some that shows that having aspirin daily can decrease your risk of developing prostate cancer. So that concludes my presentation on prostate cancer. If you have other questions or concerns, there are resources that you can reach out to, such as the Prostate Cancer Foundation website at pcf.org. There's also information on cancer.org. You can reach out to your primary care provider for additional information or questions, or if you have a urologist that you see for other reasons, this is definitely something that you could discuss with them. If you could please take a moment to complete the post-test to see how much information you have learned, it would be appreciated, and thank you for joining me for this presentation.